So an ambulatory surgery center is a center designed to do outpatient operations, and in our case that would be outpatient spine surgeries. The center is dedicated to that task, so we have preoperative and postoperative care specific for outpatient spine surgery. We have tools and equipment within the OR which allow us to do those technologically advanced, minimally invasive procedures. We've utilized our surgery center to care for patients that would benefit from outpatient spine surgery for a number of years. It is better in the sense that it's dedicated to that one particular patient population. So we have an expertise both in the pre and post-operative areas, and every individual that you come in contact with there has some understanding of what you'll go through that day and what your recovery will look like. That's very comforting for patients. I enjoy working at Carolina Center for Specialty Surgery because I have input in the equipment that we have in the operating room. I'm able to work closely with individuals consistently, so we develop best practices for care of different conditions. We work with our anesthesia colleagues very closely so patients have a good experience through their anesthetic, and all those factors promote better outcomes for our patients and more consistency, and those factors have been shown in our quality data as well. Once we determine that a patient is a good candidate for a minimally invasive spine operation, then we have that patient evaluated from a medical perspective to determine what the best location of their surgery should be. Most healthy patients that don't have significant medical issues are candidates to have their procedure done at the ambulatory surgery center. Patients who have outpatient spine surgery at our surgery center have a more convenient access to the facility. They interact with providers, both nurses, anesthetists, and anesthesiologists who take care of spine patients on a routine basis. So they experience consistency and familiarity in their care. That also helps with education. So patients have a good understanding of what their day will be like at the surgery center, what the postoperative recovery will be like. I've worked at Carolina Center for Specialty Surgery for over a decade, and during that time I've formed close bonds with many of the people that help us perform our surgeries and take care of our patients pre and post-operatively. That familiarity and consistency is very helpful in generating good outcomes with our patients. We realized over 17 years ago that there was a great opportunity to offer outpatient spine surgery for many of our patients. And 17 years ago now we partnered with what is now Atrium to develop Carolina Center for Specialty Surgery. And over 17 years we've had great success at that facility in providing care for those patients who are good candidates for minimally invasive surgery. We've paid particular attention to our outcomes, which have been very good, and having that center has allowed us to do a lot of investigational work, which has also allowed us to develop new and innovative procedures, so conditions previously treated with open surgery can now be treated minimally invasively.